Hello, my name is Isom, and today I'm going to talk to you about cardiovascular disease. I've been in healthcare for the last 17 years as a paramedic, and in that time I've transported hundreds of patients that have been affected by cardiovascular disease. Cardiovascular disease is the number one killer of both men and women according to the Journal of the American College of Cardiology, and has been since the onset of the 20th century. 1 in 4 Americans will die from cardiovascular disease. 26% of Americans will die from this disease. In 2010 alone, $316.4 billion of money was spent in healthcare costs associated with this disease. Originally, it was thought that cardiovascular disease only affected men. However, it is now known that it equally affects women as well. Today, I'm going to tell you what the risks of cardiovascular disease are, what it is, and some things you can do to help prevent it. First, we're going to talk about the anatomy of the heart and the coronary arteries. The heart is a large 4-chambered muscle that sits in the left side of your chest. It is made up of 2 atria and 2 ventricles. We have a right atrium, a right ventricle, a left atrium, and a left ventricle. The right atrium pumps blood to your right ventricle. It then travels around to your lungs, pumped back to the heart, where it is pumped into the left atrium, into the left ventricle. It then travels through your body, through your central circulation. It is distributed to your tissues and organs where it provides oxygen and nutrients. Waste products are then transported back to your heart and lungs via the venous system. This whole process is known as a cardiac cycle. This whole process takes approximately 0.8 of a second and happens about 70 times a minute in an average adult. That means your heart beats 70 times a minute as an adult on average. Each beat of your heart pumps approximately 3 ounces of blood, and in the course of 1 minute, will pump 5.5 quarts of blood, and over the course of 1 day, will pump over 2,000 gallons of blood. To put that into perspective, think about an 18-foot diameter swimming pool will hold about 6,500 gallons of water. So in the course of just over 3 days, your heart will pump enough blood to fill a swimming pool. The coronary arteries branch off of the aorta and directly feed the heart muscle itself with oxygen and nutrients in order to provide it with the needed nutrients to pump blood to the rest of your body. Now that I've given you an overview of the cardiovascular system, I'm going to give you a brief description of what coronary artery disease is and how it affects the coronary arteries. According to the Mayo Clinic Heart Book, written by Dr. Gersh, even one diseased coronary artery can lead to coronary artery disease, which is a buildup of fatty deposits on the artery walls. This buildup of plaque is known as atherosclerosis, which is a narrowing of a vessel. It can happen to any vessel in your body, but for this sake of this purpose, it's only going to affect your coronary arteries. So as this plaque builds up and it narrows that artery, less blood flow gets through to your heart muscle. As this continues to build, it's eventually going to become completely blocked, which will then cause a myocardial infarction or a heart attack. Now that I've kind of told you about what the cardiovascular disease is, I'm going to kind of tell you about the signs and symptoms associated with this disease. In order to know what the signs and symptoms are, you have to know what a sign and a symptom is. A sign is something you can see. I can see that chair. I can see a stop sign. A symptom is something you're going to tell me. I can't see it. It's subjective. So if you're telling me you're having chest pain, that's something you have to tell me. I can't physically see that. So what are the signs and symptoms associated with cardiovascular disease or a heart attack? Well, they're going to be things such as chest pain, chest pressure, heaviness in your chest, a weight. You can have radiation to one or both of your arms. You can have nausea with or without vomiting. You can have difficulty breathing or shortness of breath. You may have diaphoresis, which is a sweating. You may have no symptoms at all. You may feel anxious. Sometimes people don't have any symptoms until they have a simple event such as an MI, and that's when they learn that they now have cardiovascular and have had cardiovascular disease. So now that I've told you what these signs and symptoms are that are associated with this disease, let's talk about some risk factors that are associated with it. There are 2 types of risk factors. There's modifiable and non-modifiable risk factors. Modifiable risk factors are the ones that you can change. There's things such as smoking, type 2 diabetes, high blood pressure, high cholesterol, using alcohol in excess, stress, psychosocial factors, anxiety can play into it. And then you have your non-modifiable risk factors. Those risk factors are going to be things such as your gender, your race, heredity. Those are things you cannot control. There's nothing you're going to do to affect those risk factors. So what can we do as people to decrease our risk factors? Well, we need to modify those risk factors that we can change. So stop smoking, choose better diet. If you're on medication for cholesterol, for blood pressure, take that medicine as prescribed. If you're sedentary or overweight, do things to lose weight, to get healthy, get active, the things that are going to help decrease those modifiable risk factors. Prevention and controlling these modifiable risk factors are the single best way to prevent and stave off getting coronary artery disease. I hope by giving you this information today, you'll increase your knowledge of cardiovascular disease and know the signs and recognize them by me telling you that what it is, how to recognize